My name is Madison Williams, and this is lab number 1 for comprehensive health assessment.
My name is Jeffrey Williams, and I consent to be recorded for this video for this class.
First, we will be starting out with the visual acuity test with the Snellen eye chart. This patient, Jeffrey, wears glasses, so we will leave them on for this exam. First, I'll have this patient cover one eye at a time to read the Snellen eye chart as far down as they can, and then switch eyes, and then uncover both eyes and do the same. First, we will cover the left eye.
E, F, P, T, O, Z, L, E, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Good. Now switch.
E, F, P, T, O, Z, L, E, L, P, E, D, P, E, C, F, D, E, D, F, C, E, P, F, E, L, O, P, Z, D.
Could you read any further?
No.
Now for both eyes.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, P, D, E, T, P, O, T, E, C.
Good. This chart was positioned approximately 20 feet away from the patient. Next, we will test the visual fields with a confrontation test. I will have my patient face me and be approximately 2 feet away. I will first have the patient cover their right eye, and I will cover my left eye. Look straight ahead at me, focus on my face, and let me know when you see my finger in your peripheral vision.
See it?
Okay, switch. Patient is covering their left eye, and nurse is covering their right eye. Same thing, let me know when you see my finger.
See it.
Good. Now, we will test the peripheral vision by seeing how many fingers and where he can see them.
2. 1. 4.
Switch.
1. 1. 2.
Next, we'll be inspecting the extraocular muscle function using the Hirschberg test. I will instruct the patient to look forward, and I will be assessing the cornea reflection of my pen light. Look straight forward at my eyes. Good. Next, we'll be assessing the diagnostic positions test. This will be done by holding my finger approximately a foot away from the patient and telling them to focus on my finger while I change positions to the 6 cardinal locations. I'm going to stare forward, focus on my finger, and follow my finger in the direction that it goes. Always coming back to the midline, monitoring for any shaking of the eyes, otherwise known as nystagmus. Noting any crossing of the eye, any involuntary muscle movements, and symmetrical tracking of each of the eyes together. Next, we will be doing a general ocular observation and inspection. We will be noting. Next, we will be looking at the symmetry and alignment of eyebrows, symmetry and alignment of pupils, as well as any redness, scaling, lesions, or abnormalities. We will be looking for any eye bulging, otherwise known as exophthalmos, sunken eyeballs, as well as protruding. Next, we'll be analyzing the conjunctiva and the sclera of the eyes. I'll ask the patient to look up as I place my thumbs on the lower eyelids without pressing on the eyeballs themselves. We'll be noting any redness, lesion, or any other abnormalities. We'll then be looking at the conjunctiva sac and noting any redness or excess tearing. In order to assess the lacrimal apparatus, we're going to ask the patient to look down, and then with our thumb, we are going to pull back the upper eyelid, analyzing for any color changes or swelling. No tenderness as well. Next, we will be inspecting the anterior structures of the eyeball. We will use the Perla method. Pupils equal, round, react, light, and accommodation. We will be analyzing the pupillary light reflex. I will now dim the lights. Next, I will ask the patient to gaze into the distance, and then I will shine a light twice from the outside in, inspecting the eye closest to the light first, analyzing constriction of the pupil. Then I will shine the light again and analyzing the further eye to see the subsequent constriction. I will do the same on the other eye. Number 1, constriction. Watching then the other eye. Number 2, constriction of the left eye. Next, we will test for accommodation. This is done by having the patient stare off into the distance, then asking the patient to focus on your finger in front, approximately 3 inches away, and then we're going to ask them to stay focused on the finger as we move closer and further from the patient, looking for any eye crossing, involuntary eye movements, as well as the pattern of stare. This next section will include palpation and inspection and assessment of the head and lymph nodes, as well as the analysis of facial structures. First, I will monitor the patient for change in expression throughout the visit, as well as noting the patient's face and skull size. I'll begin by palpating the skull, feeling for any protrusions or misshapen abnormalities. Next, I'll palpate the temporal area using 2 fingers, noting any tenderness or protruding veins. Next, I will move to the temporal mandibular joint and ask the patient to open their mouth and close, and repeat. We will be noting any pain and the smooth movement present. While assessing this patient, I will note any symmetry abnormalities in the nasolabial folds, as well as the sides of the mouth. Next, we will be assessing for range of motion, as well as noting any weakness and uncontrolled movements of the head and neck. I'll first ask the patient to look straight forward. Then I will ask them to put their chin to their chest, back up to midline, noting any deviation in neck position, and then I'll ask them to put their ear to their shoulder without raising their shoulders, noting any pain expressed, and then switching to the other shoulder. Then, back to the midline, we will look to one side and to the other. We are noting the range of motion, control of movement, and any weakness or pain. Next, we'll be analyzing the spinal accessory nerve, cranial nerve number 11. This will be done by asking the patient to shrug their shoulders as I push down and release. We will be noting weakness and symmetry and strength on each side. Next, we will be palpating the lymph nodes. We will start with palpating the preauricular area, then going behind the ears, the postauricular area, to the occiput, then down the submandibular, the postmental, next to the trachea, all the way down, and then back up. Then moving on to the superior clavicle, and then moving underneath of the clavicle area. If any nodes are felt, we will assess them for the size, mobility, tenderness, and location. Next, we will be assessing the trachea. We'll have the patient look straight forward and make sure that it is in the midline. We will then be making sure that the trachea is movable, placing the index fingers, moving it to one side and then to the other, making sure that it moves evenly from both sides. Next, we will ask the patient to look up to analyze the thyroid. I will pull to one side and ask the patient to swallow, noting the movement up and then back down. We will be using the posterior thyroid assessment. First, I will go behind the patient and take my fingers next to the trachea, asking the patient to swallow and release. We'll be noting any deviation, swelling, and feeling for the thyroid behind the swallow. For the final part of the thyroid assessment, we'll be asking the patient to put their head slightly forward and to the right. With my right thumb, I'll be displacing the thyroid to the patient's right side, and then with my left thumb and my index fingers, I'll be feeling the sternocleidomastoid muscle and asking the patient to swallow, assessing for any nodules or any other abnormalities. This concludes lab number 1 for comprehensive health assessment. Now, I will gather all of my subjective and objective data to create a summary.
Thanks for watching.